Just want to bring in former Wisconsin Governor, former U.S. Secretary of Health and Human Services, Tommy Thompson, right now. Secretary, good to see you. Thanks so much for joining us.
Well, thank you so very much, first, for being here. Thank you for having such wonderful people on your show, and thank you for just coming to Wisconsin.
We appreciate it. You know, earlier Rachel said, look, there's all this money coming into Wisconsin because of the U.S. Open. How big of a deal is this? How big of a deal
money
is
and
this?
cheese coming to Wisconsin.
You got enough cheese here. You don't need any more cheese.
Look at the beauty. I mean,
it's gorgeous.
This is Wisconsin.
But seriously, I mean, is this a big deal for the state in terms of having the U.S. Open? How big of a deal is it?
It's a huge deal. It's the first time, you know, that the U.S. Open has ever been played in the state of Wisconsin. And to have this beautiful course right under the auspices and the site of the Holy Church, the Holy Hill.
That church which you helped revive.
Helped revive. And it's just a beautiful location, beautiful place. And so many people are dedicated, you know, to make this the most wonderful and most memorable time. All of you from New York and Virginia, of course she's from Wisconsin, are going to have here.
Yeah. Okay, good.
It's easy for Wisconsin to do that because the people are so genuinely kind. I'm always blown away by the just built-in hospitality. They don't have to try to be nice to other people.
The W, welcome to Wisconsin. Genuine, nice people.
We saw that when we were here for the debate as well.
We were glad to be. When we found out we were coming, we were very happy when we found out.
Just think about how many people, not just the people that are coming to this event, but how many people are watching on television or hearing about it on social media, are going to see for the first time what a gorgeous course this is, and they're going to come back to Wisconsin. So the money's going to keep coming.
Rachel, just keep saying that. Yeah, keep saying that. We're Mr. and Mrs. Tourism today.
Yeah, I was really surprised to hear Jay Monaghan, who we just had on, PGA Commissioner.
Yes, wasn't he nice?
Yeah, this is a course that these players come. They've never played here before. They've never been here before. I mean, it's interesting that for the U.S. Open, such an important event, that they're coming cold.
It's coming cold, and a lot of people from Wisconsin have never been here, and a lot of people have never played this course.
Yeah.
And it's going to be an eye opener to see the beauty. And this is the longest course that's ever been played at the U.S. Open. And so it's in Wisconsin. It's got some unique characteristics: the beauty, the fescues, the length. And I think there's going to be some people who walk away and say, what a beautiful course, what a beautiful state, what a beautiful opportunity for Wisconsin.
I love hearing the clapping behind us.
I know.
You know, as Theo has begun. Let me switch gears, Secretary. Let's talk about sort of the issues of the day. Obviously, the shooting yesterday.
So
Our hearts go out to the Steve Scalise family, the Mika family. We're all hoping that they get better out of this critical condition, as well as all of the victims yesterday. Your thoughts on what took place?
Well, we hope and pray, you know, of course, that Steve and all the individuals that were injured, especially those wonderful police officers that stood up and saved things.
Thank God for them.
Oh, just wonderful. And it shows you, you know, how much hatred there is in the United States right now. We got to get over that. We got to get back to being nice to each other. Wisconsin nice.
Yeah,
and hopefully the U.S. Open, hopefully what took place yesterday, maybe a new beginning. Maybe we can start talking, you know, civilly.
Well, Rachel said she thinks this is going to bring people together. Unfortunately, you don't want an event like that to bring people together, but you do think that, Rachel. You said that.
Well, I think at least in the House, in the Republicans in the House, I think that this has really brought into clear focus that there is an effort on the left to stop this agenda, which brings me back. You were the HHS Secretary. Do you think Tom Price and the Republicans can fix health care? Do you think this is going to get done?
They have to fix health care. I mean, that's what they've been lobbying for 7 years. They've got to fix it. They cannot walk away without getting it fixed, and it's important. It can be done, and it should be done. And the healthcare system is going down now, and it's got to be repaired and fixed, and I think the Republicans have got to take the leadership and get it done. But I also would like to just say, you know, I was secretary on 9/11, and I can remember 9/11 like it was this morning. And that evening, everybody came with candles and came over to the fountain and walked around, and Republicans and Democrats and Independents. And maybe the same kind of thing can happen. And for a long period of time, we came together as a nation.
Sometimes
and hopefully
does that.
And hopefully it's that kind of a thing yesterday is going to bring us back together again. But health care has got to be fixed. And thank you for the question.
Yeah, no, we want to talk more about it because this is part of the agenda, Dagan.
But I want to ask you this because you're hearing the narrative more and more about single-payer payer, particularly from the left, that single payers is going to be the ultimate solution because it's easy, it's simple. And the Republicans are at a disadvantage fixing Obamacare because the Democrats have already made Americans believe that health insurance is a right that's guaranteed to them by the government, that ultimately it's the responsibility of lawmakers to provide health insurance to everybody in this country. So Republicans start at that deficit, trying to fix what they've got.
But the truth of the matter is the Democrats are much better at getting their message out than the Republicans have been on health care. But health care is not something just a single payer is going to fix. Right now, the Obamacare, the Affordable Care Act is going down. It's unaffordable, and there's so many insurance companies. You got to fix several things. The first thing you got to do is you got to give individuals the opportunity to have a tax deduction. You got to be able to sell insurance across the state lines. You've got to make it more competitive. You've got to make sure that insurance companies are going to do it. You have to get a stimulus to employers so that employers want to give their employees health insurance. You start there, and you've got the makings of a health care bill. But you cannot go in and have individuals that have had health care before not have it anymore.
Yep.
So you got to fix it. But you got to be there with the idea that you're going to be able to allow health care to be expanded, to give individuals an opportunity to have health care. We have to do that in America.
And they want to see premiums go down. With what you know, what's the bill in the Senate right now, with what you know about what the House put forth, does it get premiums down?
The premiums will go down under the House bill, but the problem with the House bill is there's too many people that are not covered. And so, but there's about $115 billion in money that the Senate has to be able to play with. So you're going to, not play with, but be able to allocate to areas that you're going to be able to get more people covered. And that's what America wants. They want coverage, and they want to be able to have insurance that's competitive and cover it, and you want to get the insurance companies back in so that they can make a profit, but be able to sell insurance. And you have to allow them not just to have a gold, bronze, silver, and so on. You got to allow the insurance companies to come up with insurance products that people want.
Yep.
Some people want higher deductibles, some people want more coverage, but you got to give individuals the opportunity to pick the insurance policy or program that they want for themselves and their families.
Well, if you say it's doable, then I believe it's doable. We should be able to do this. Governor, Secretary, great to see you.
You're wonderful, and thank you again for coming, and have a great day. And remember, this is Wisconsin, and this is typical all over the state.
We love it. We love it. Governor Tommy Thompson joining us.